and welcome everybody. I think it's 2 o'clock, so I'm gonna do a little bit of housekeeping while we have all people joining here for a minute. You all joined on mute. Please feel free to unmute yourself when you want to ask a question. We'll pause at specific moments for questions, so you can save them for then, or if it's something you feel is particularly relevant to what we're talking to at that moment, please feel free to unmute yourself and ask, or use the chat function for doing that. I know you all are probably well versed in Zoom at this point, but just to note, all your controls are in the bottom. I find it particularly helpful to look at speaker view so that I can absolutely see who's speaking to me. But if you like panel view, feel free to do whatever works for you all. Definitely welcome everybody to turn on their camera if you feel comfortable doing so. It's nice to see faces since we so often don't get to see faces outside of our own family and the people we're sharing space with. So invite you to do that. Let's see. And I think that is it. This is being recorded. So I think you had to give your permission before signing on, but hopefully that's okay. This is going to be structured yet casual. So again, please feel free to hop in and ask questions. We're going to start with some introductions and then move into some basic information about the university and school. Do a quick little poll for an icebreaker, and then talk more specifics about the program itself. And then our panel should be joining us about 2:30. And they've got some specific questions we've asked them to reflect on and share. And then of course you are welcome to ask them any particular questions you might have. And then we'll let them go when those are over, and then we'll finish up with any questions you guys have. We have this going till 3 o'clock, but no problem staying longer if there are additional questions. No problem not using the full time if there aren't. So again, totally structured but casual is how I like to call it. So I'll start by introducing myself, and then I'll turn it over to Theresa. And I'm hoping I can figure out how to drive the PowerPoint in. Okay, I think that's gonna. Are you guys seeing, what view are you seeing, Theresa? Are you seeing like speaker view? Or are you seeing?
I'm seeing your screen. So I'm seeing, I don't, prior to this screen, I mean, what's showing, I see there, that's better. Now I see the entire slide.
Now I figured it out.
That's us.
I got it. You'd think after 8 months of Zooming, we'd have absolutely everything figured out, but not so. So I'm Sarah Ball, if you can't put the face with the face. I'm currently the assistant internship director here at the School of Public Health Dietetic Internship. I've been with the internship for 3.5 years, 4.5 years, with the University of Michigan for about 8. I've lived in Ann Arbor for about 8.5 years. I am not originally from Michigan. Little something personal about myself. I have 2 kids. I love to hike. I love warm weather. So I'm particularly happy that we are enjoying a 63-degree sunny day here in Ann Arbor, although I haven't had a chance to actually go outside and get to enjoy it yet. And now I will turn it over to Theresa, and she can introduce herself.
Hi, so I'm Theresa Han-Markey, and I've been at the university for a number of years, and at one point was the DPD director for our program, and moved over to the internship program sometime in the mid-2000s. Currently, we have it's either our 11th or 12th internship class going right now, so we're pretty pleased by that. And I also have a couple of kids, but mine are a bit older than Sarah's. I have someone that is married and lives in the Boston area, so I'm very familiar with that area. And I have one also who's in seclusion in Brooklyn, New York. And so I certainly know that area of the country too. And I am a native Michigander, so that's just a little bit about myself. I guess we can go ahead and proceed. For those, just as a reminder to all of you, our dietetic internship program is sponsored by the University of Michigan's School of Public Health. And we've had a long-standing history here at the university.
Want me to play?
Sure.
Can you hear?
No, did you want
Hold
me
on.
to talk over?
Nope. It's just the way I knew that was going to happen because I've got my headphones in. Hold on.
We have,
Now can you hear?
Yesterday,
yes.
and it won't be done tomorrow, or next month, or even next year. In our classrooms and in the communities we're privileged to serve. Across Ann Arbor and across the globe, this is our journey. We build strong partnerships beyond these walls because our complex world demands diverse perspectives. We give the best of ourselves for those we may never meet because we want a healthier world, a more equitable future. We create knowledge through discoveries, large and small. We innovate, blaze new trails, pursue ideas. It's who we are. Because at the end of the day, our belief in this work is why we're here. And it's why tomorrow will begin again. We are Michigan Public Health, and this is our pursuit.
Well, what you have up here is the mission of our dietetic internship program. So I'll let you all read that yourself for a few seconds. I believe what differentiates our program from other programs that perhaps you're considering is the fact that we do have a strong public health component. And of course, that is because we are sponsored again by a School of Public Health. Next slide, Sarah. Whoop. So as Sarah was hinting, our school has been around for a number of years. Again, it was founded in 1941. Our internship program has been established since 1993. We are a community-based internship. We've had this emphasis area for a number of years. And from a historical perspective, nutrition has been a part of the public health curriculum since the inception of the School of Public Health itself. Some other fun facts about the University of Michigan School of Public Health, which you may not know or have at the tip of your tongue, is that we did establish the beginnings of Blue Cross Blue Shield, if you can imagine. Of course, that did not come out of the Department of Nutrition, but from our school. The other interesting entity that was part of our history is NSF, and that does not necessarily stand for the National Science Foundation, but rather an organization that is actually located in Ann Arbor. It stands for the National Sanitation Foundation, and it is a certification and safety organization. I think how it relates best to the area of nutrition is that if that organization certifies supplements, for example, food supplements or herbal supplements, and so if you were to turn over a bottle, you could find out whether or not it was actually, again, certified by our group here. And they have some interesting contracts with, for example, the Major League Baseball team. or excuse me, the Major League Baseball organization. And I'm not absolutely sure we have the NFL contract or not. The reason I bring this up is we do have grads that have gone on to work at this entity. Also, another fun fact is that the University of Michigan did establish the first Earth Day. We have a very famous epidemiologist and physician who was part of the earlier polio vaccine trials, and so that we were a site of that. And more recently, now this is a very hidden fact that only a few people know, we have one of the largest culinary archives in the nation. We are second to the collection that's held at Harvard, and it's titled the Janice Bluestein Langoni Culinary Archive, and it has an incredible amount of materials. It's actually more than 30,000 pieces are held here. We have like the first African-American cookbook, along with various menus and other historical books dealing with food and things of that nature. So recent discovery for us over the last 10 years. We're pretty proud of our registered dietitian exam pass rate. Over the last 5 years, we've averaged 93.5% for all first-time test takers. And for those that didn't pass the first time, but again, retook the exam within as soon as they could, they also passed. So overall, over the last 5 years, we do have 100% pass rate. Looking back over the last couple of years, our employment statistics are also something to be proud of. We have nearly 100% of our graduates are employed within 6 months of finishing our program. And this diagram shows you some of the areas of employment in which, again, the graduates of our program end up in. The font might be a little tiny, but I can certainly share that with you. The orange highlights the majority, or one of the majorities of our grads. We're pretty much equally split between the orange, again, which is the outpatient clinical areas, and then the blue, which is our inpatient hospital employed clinical dietitians and dietitians that are working in our skilled nursing facilities. And the last part of the pie are, again, our grads that are working in the community, public health, and wellness sectors. We have an extensive alumni network in which we have kept track of the majority of our graduates from our internship program, probably really good records for the last probably 15 years or so. What I'd like to highlight, I just put this picture together, which isn't perfect, but it does highlight for you the breadth of the locations where our alumni are employed. I had to put in one in Seward, Alaska, because that's probably one of the most unique areas of employment, well, unique locations. She's actually working in Seward as a clinical, community, and outpatient dietitian, pretty much a jack of all trades. If you can imagine, she's probably one of a handful of dietitians in Alaska. But we also have a number of our alumni located on the West Coast, locally here in the Midwest, and as far south as Florida, Southern Florida, New Mexico, and Texas.
Okay, so now we're just going to do a quick, I call it an icebreaker, but really I had no idea how many people were going to join, so I put it into a quick poll instead. So I'm going to launch the first poll, give you a chance to vote. Tell me if you can't see it, because I've been known to mess this up.
I can see it, Sarah.
Okay, cool. And then I'll share the poll after everybody's had a chance to put in their vote. And it's anonymous, by the way, so you don't no names or anything attached to it. And this is basically asking you, from what you know about our program so far, I'm assuming you did some background research before you hopped on today, what interested you the most? Give it a few more seconds. I think there's still 2 people who haven't voted if they wish to. Oh, there's a second question too. Well, we're not supposed to pop up at both at the same time, but again, I don't know what I'm doing. So also, where do you call home? That is the second question. Okay, so I'm going to end the polling, share the results with you guys. So it looks like we have somebody checking something for everyone, or all these different things, but it looks like access to university resources and our reputation was one of your primary interests. I don't blame you. I agree that University of Michigan and the School of Public Health have a great reputation, and we do have access to top-notch resources. So not a bad thing at all. Also the location and the community focus. And then where do you call home? Let's see, we've got one person from outside the US. Most of us here are in the Midwest, a couple from the East and the West Coast, and nobody today from the South, the Northeast, or Central United States. So that just gives us a little bit of an idea about you guys, our participants and prospective interns. Okay, gonna turn that off. Again, please, if you have any questions, pop them into the chat or unmute yourself. Before we move into the more detailed nitty-gritty internship stuff, does anybody have any just sort of general burning question they'd like to ask? And I'll just pause for a moment to let you gather your thoughts and type if you need to.
Sarah, this poll is still showing on my screen. I'm not sure if that means if it's me or you.
I don't know. I have it off mine. Maybe you have to close it yourself.
Oh, sorry.
Personally.
Yes.
Yeah.
Yes,
okay.
I did. Thank you.
Okay. Woo, hold on. So just a little bit of the details. We are accredited for 30 interns a year, and that's the number we always try to reach. We do have our own DPD program here at the University of Michigan, with a focus and concentration in dietetics, a graduate program. And so we allow those students to pre-select into our program in January. And then whatever space we have left over, we utilize the match to grab those candidates. Every year for the past couple of years, I believe we've pulled several from the match. Last year we had 4 or 5, maybe even 6 total. I forget now. They've become so integrated into our class, I sort of forget who's who. Previous years, we've maybe only had 1 or 2, but we anticipate this year to have quite a few spaces. And so this is why we, really for the first time, are advertising our program and doing this virtual open house. Generally, our start date is the week after the 4th of July. The 4th of July falls on a really funny date this year. I believe it's a Sunday. And so we're going to be starting July 12th. That would be our first day. And that first full week is an orientation week, which is a mandatory orientation. Our end date, I kind of put no earlier than February 11th because one of the great things about our program is we allow for a lot of flexibility. So part-time status, full-time status, the submission of prior learning hours, possibility to start a few rotations early. And so definitely a little bit of play on where people end up. But for the majority of our people, they usually end up finishing near the end of January or beginning of February. We are a program that provides 1,280 supervised practice hours. And we do ask for a 200-hour reduction, or we do award 200 hours for prior learning. And so prior learning can look anything like community hours you've volunteered for, if you had to do a practicum as part of your master's work or a master's thesis, any of that kind of stuff can be applied towards the supervised practice hours. Our training hours for most people are full-time, 40 hours a week, not including additional assignments and preparation. So it is a full 27 to 35 week program. But there is a part-time option available. We only ask with those choosing to do part-time that they do it 3 to 4 days, full days a week. That's really the only way it works well. Any less than that, and there's just too much time switching back and forth. But that has worked well for lots of people. And that 32-hour option actually allows you to balance your life a little bit better, possibly work to support yourself during the program easier, and you only get out about 5 weeks later than everybody else. So it's really not that big of a deal. I really like to talk about that option because a lot of our interns like to do the full-time option and hold a part-time job. We fully appreciate that. It's hard to go unemployed for this long of a period of time and support yourself. However, it can get a little dicey sometimes, working around rotations in work, and also can be a little stressful. So if this is something that you know is going to be a challenge, I highly recommend, if you were to match with us, that you think about the part-time option. And then our payment as of right now is an $8,000 internship fee that's due by July 1st. Any questions about just those basic nitty-gritty details? And trust me, there's more, so no worries there. This is a little bit of information about how we break down our rotation hours. These are approximates. Nothing is set in stone. Well, some things are set in stone, but for the most part, these are approximate hours. One thing we've learned with COVID is we can be extremely flexible and have to be extremely flexible at times. We pride ourselves in being an internship that allows for a lot of flexibility, and we really allow for a breadth of experiences over extreme depth. So you might notice that we only have 160 hours in an inpatient clinical experience. That's 4 weeks full time. That may look very different from some of the other programs that you might be looking at. We do the majority of our clinical hours in outpatient clinical facilities and skilled nursing facilities, which is one major difference between ours and other programs. We also do 80 to 120 hours of community-based work. This is true work in the community, helping people in the community in which they live. And so I'll talk a little bit more about that. Skilled nursing facilities, 2 to 3 weeks. Everybody does a WIC or some form of child nutrition rotation for 3 weeks. Food service is another one where you might see that we have a slightly reduced hours than some other programs at only 160 or 4 weeks. And then everybody has the option to do elective if they choose. This is not mandatory. We will fill these hours in other ways if you have if you don't want to do an elective. But electives are really nice for you to explore either a little deeper in an area that you'd like to gain more knowledge in, or an area that we don't really offer as part of our normal rotations. So some examples of what people have done in the past, policy or program work. We've had anything from people going to the Michigan Department of Education here in our state, all the way to DC to do some work with, let's see, the Center for Science and Public Interest. I believe we've had some people at the USDA do some rotations. I'm trying to think of some other ones, but those are what's coming to mind for policy and program. In addition, a while ago, the Food and Nutrition magazine, put together by, I believe, the Academy, used to take interns, and so we had several people do that. We've had people work with more integrative functional private practice dietitians. We've had people work in wellness or for different companies. I'm trying to think of couple of the examples of that, but the exact company names are not coming to me. But those are just some examples of how people have eating disorders is a big one. We have had a lot of people go to specific eating disorder clinics in our area, but then also across the United States to do elective rotations. Are there any research options I see in the chat? Absolutely. Theresa and I happen to work in a research unit. So the second part of our job, there's a lot of opportunities for clinical research. And definitely we find that a lot of our interns do a week or two with us and find that very valuable. And I believe there have been some other research options over the years, depending on where people live prior to coming to us. They might do something somewhere else as well. Any questions about that? Okay, so just to give you a little bit of an idea, I realize if you're not from the Ann Arbor or the Michigan area, which obviously quite a few of you aren't, this might be somewhat meaningless, but feel free to take a screenshot of this and look these places up when you get a chance, or a lot of them are listed on our website as well. But really our goal for our clinical rotations and that part of your experience is to provide a solid foundation in your medical nutrition therapy concepts, the nutrition care process, and nutrition counseling. And so that's what these rotations are really designed to do. We utilize a number of different hospital systems in the Southeast Michigan area, anywhere from Detroit down to the Ohio border, a lot in our area, and a lot even, some even a little bit north of us. These are just examples of some of the places that we utilize currently. One thing that's different about clinical this year that I think is going to continue regardless of the COVID situation, which I can only hope is going to be getting better, not worse, is the use of telehealth. And so everybody was sort of forced into a telehealth framework this year, and I think they've seen a lot of positives to using that. And so definitely in our outpatient clinics, I see that being utilized in some way, shape, or form going forward. A little bit about our community rotations. Really our goal here is to provide an understanding about how nutrition education can be implemented in that person's environment, so outside of that clinic environment, and explore the social determinants of health in a variety of settings. And so again, these are just some examples of organizations that we work with. Food Gatherers is a food rescue and distribution organization. They also run our local food pantry and community kitchen. Obviously, health departments, Meals on Wheels. Growing Hope is a small local organization. Brilliant Detroit really works to provide health care to the community in Detroit. So those are some examples of that. Lastly, food service. Basically, we want to provide you a comprehensive overview of the different areas of food service from start to finish. And so again, we utilize residential dining, which is college dorms. We utilize some school systems in the area to look at school food service. And then we utilize some of our hospital systems to allow people experiences in hospital food service. So here's just some frequently asked questions that we hear. And so I thought I would just kind of run through the answers to these, and they'll probably answer some of your questions that you have right now, and they'll probably spawn some follow-up questions. So after I go through these, we'll pause before the panel to really allow you to ask some more in-depth questions if needed. So first, like, what makes a strong candidate? We're looking for strong written and oral communication skills. We are looking for strong graduate and DPD grades. So if you didn't notice already, you do have to have a graduate degree to be in our program, or at least obviously by the time you match, you might still be finishing up your graduate degree. So you do have to be in the tail end of that to get in. We no longer look at GRE scores, so that is not, doesn't really make a difference for us. We're looking for strong recommendations and people who have done sort of a variety of different volunteer, practicum, or have a variety of work experiences. All those things kind of form together to make a strong candidate. But we really do take a holistic view of each person. And so there is not one thing that's going to really, give you a strike on your application and just boot you out. We really like to look at everybody as a whole person. How far can I expect to drive for rotations? Our basic rule is we try not to place anybody outside of a 60-mile radius of the School of Public Health. For the most part, we stick to that quite well. This year it's been a little tricky, but even then we've been able to make 95% of our rotations in this area. So and we try to make a vast majority of the rotations are in the Ann Arbor area. So or going to be telehealth. Therefore, driving isn't a huge deal, but it can definitely affect some people, and some people choose to not live right in Ann Arbor, right? So some of our own graduates may move home for the internship, and they may live in other areas of Southeast Michigan, and then we really work with them to kind of place them in those rotations that are closer to where they live. You do not have to have a car. However, a car definitely allows for a lot more flexibility on your part. It allows us to place you in rotations that might be really good for you that we wouldn't be able to do otherwise if you didn't have a car. And then there is the expectation that sometimes, even if you don't have a car, you would get placed in a rotation where you would need one. And then it would just be up for you to provide that for yourself, whether it be renting a car, borrowing a car from a friend or a parent or something like that. Can I explore rotations on my own? Absolutely. A lot of those electives are something that we ask for you to explore on your own. Those can be in the Ann Arbor, Southeast Michigan area. They can also be anywhere in the United States. So there's a lot of flexibility for those elective rotations. But then in the past, we've had people who want to do maybe a WIC rotation somewhere else, or want to do their food service in a different environment. And we allow for that as well. So once you are accepted into the program, we would work with you to really tease all of that out. I think I already answered the GRE question. We do not utilize GRE scores anymore in our application process. The fee for the match application is $75 to us. That is on top of the DICAS and the computer match fee, which I'm blanking off the top of my head what those fees are, but I'm sure you guys know that better than we do. Can I start earlier than the July 12th deadline? Yes and no, we can work with you on that. If you would like to start earlier, that is a possibility. But those rotations that are available are definitely much more limited. But the possibilities do exist for doing that. Can I take a vacation or days off? Absolutely, we can work and build your schedule around that if we know that they exist. So obviously we know that things happen in the middle of the internship where you have to take a day or two off, and we allow for that. But if you do know that you're going to be taking a family vacation in August or something like that, we would just need to know ahead of time. What holidays do you have off? Built into the internship are several holidays. Basically, we follow the University of Michigan calendar. So for a typical July to February year for the internship, you have Labor Day off. We allow the whole week of Thanksgiving. Part of that we give you to do some research on the conference that our interns do every year. And then obviously you have the days off for Thanksgiving. You have 2 weeks off for winter break, the last 2 weeks of December. Sometimes it's like the beginning of January, it kind of depends on how the new year falls. And then I believe that is it. And then again, if you need to take holidays off for religious reasons, we can work with you on that as well. Do we offer a payment plan? Absolutely. So you can pay one lump fee at the start, or we do offer a four payment plan that you would work with our administration on getting that settled, and there's a slight fee for using that. And do we provide medical insurance? Unfortunately, medical insurance is not provided. You are no longer a student in any way, shape, or form in this program. You're post-education, and so we can't utilize the university insurance plan. So you would have to provide your own insurance. Okay, I'm going to pause after all that information and give you a chance to ask any questions. I don't see anything in the chat, but if you have a question, please feel free to unmute yourself and ask. I'm just going to pause here. What about for international students? So I think you're going to have to elaborate on that. Will we also not have insurance? Correct. Everybody has to provide their own personal health insurance. We do provide professional liability insurance, which is different. Theresa, did you want to add to that? I saw you unmuted yourself.
I did. And I'm actually not absolutely sure of all the details. Our university does offer a postgraduate health insurance plan that can be purchased.
It's not an insurance plan. It is a health plan, which basically,
right.
I think you can pay up front to utilize health services.
Correct.
But it's
You're
not
right.
Insurance. Yeah.
Right. Thanks for clarifying that.
Any other questions before I turn it over? I see that we have all of our panel people here, which is spectacular. Okay, I'm gonna advance the slide and introduce our panel. We have three wonderful people here to talk to you today. Joyce Lee, who is actually a current intern. She did her graduate work at UC Berkeley and then moved here to join us for the internship. And she has been with us since August when we started this year, and will be finishing at the end of February. We have Emily Werner, who was with us, gosh, she can tell you when, but it wasn't that long ago, within the past 5 years. Probably in the past 3 years. She now works as a dietitian for Michigan State Athletics, and she's a PhD candidate there in kinesiology. She came to us from Drexel University. And then Rachel Hirschman, who I have never met. So nice to meet you, Rachel. I don't actually know when she was with us either. It was quite some time ago. She works in school wellness, and she came to us from the University of Colorado. So I'm going to ask our three guests to unmute and unvideo themselves so that people can see what you look like, if you have the ability to do that. If not, no big deal. And then we have some questions. So I think what we can do is I'll just sort of do round robin with the first question, allow all three of you to give an answer, and then we'll move on to the other two questions. Does that sound okay? Thumbs up from anybody or everybody? I can only see a handful of you at a time, so I'm just gonna assume that we're thumbs upping. Okay. Awesome. And I'll just call you guys out. How about, so we don't have people talking over each other, because I know that that's definitely a Zoom issue. So we'll start with the first question, and then I'll just go down. We'll do Joyce, Emily, Rachel, because that's how I have you listed on the slide. So if you want to just, I think one of the things I've noticed is, for the most part, we have this cohort of people that have done their graduate work here at the University of Michigan. And then we pull in these people from the outside that maybe don't know anybody, or certainly don't have the cohesion that might occur when you've been in graduate school with people for 2 years. So I'm curious, how did you sort of transition into that role, and how did you integrate yourself? So Joyce, let's start with you.
Hi everyone, I hope you can see me. I'm using my phone for the first time for Zoom, so I hope this works.
We can see you, yep.
Okay, great, awesome. Okay, so just a little bit about myself as well. So I'm originally from California. I was born and raised in LA. I went to undergrad at UC San Diego, and then I went to graduate school at UC Berkeley. So this is my first time coming to Michigan. And in my specific program, or specific cohort, I guess, we have like 4 outside students that are coming into the U of Mich DI program. And for the most part, it's been very interesting, as you probably have experienced it yourself, being mainly remote. And in the very beginning of orientation, that was like our first chance of being able to like meet people for the first time. And then throughout the internship too, you'll have the possibility of like getting in touch with other interns, either as people who you're working with remotely or in terms of even like reaching out for help and support. So a lot of it is, a lot of things that I've been doing is a lot of like outline outreach. We do have like a Slack channel that we all use, and that's a good way of getting in touch with the current cohort. Typically they add you into it. And then I think Sarah had asked us to be added to like the official Facebook group, which is what the students usually use in their time as an MPH student. But generally, you know, it's like if you want to make friends or you want to meet new people, you would put yourself out there, introduce yourself. I also have volunteered to help with the conference development, and through that way I've been able to meet other people and like connect to my cohort in that way.
Thank you. And I think just to follow up with Joyce, like she's come into a very unique situation in a year that's probably even more difficult than normal just because of our remote living, virtual living situation. And she's a really good example of, you know, putting herself out there and making it happen for herself. So Emily, how about you?
And Sarah, to remind you, I finished my DI in January 2017, so almost 4 years.
Yes.
So hi everyone, thank you for allowing me to speak today. I think I agree a lot with what Joyce said about just taking the opportunity to, you know, talk to your cohort. And, you know, it's kind of nice because even though everybody may be coming from different areas, you're all there for the same reason. So that provides an easy commonality to kind of begin a potential friendship. For me, it was, you know, I'm obviously biased in pre-COVID worlds, so I was able to, you know, meet everybody in person during orientation and whatnot. But since I'm originally from the Ann Arbor area, for me, coming from Drexel University in Philadelphia was actually me returning home. So I was able to, you know, be a little bit more comfortable, and I think it helped because I also kind of knew the area. And so the other thing that helped immensely was how welcoming my cohort, you know, mates were. I was able to meet people at the orientation sessions and begin talking with them. And then, you know, when they would have get-togethers or something like that, I typically got a text invite, and that was really great. So big kudos to, I don't know if Sarah or Theresa like asked them to do that, or it was just kind of the way it happened, but you know, everybody was super nice and inviting. The other thing that I think was really helpful for me to integrate into the class was there were a couple of rotations where I was actually paired with another intern. And I don't know if you guys still do that, but I really appreciated it because I think I actually got paired up with the same girl twice, and it formed a bond between the two of us, and we remained friends to this day. And, you know, communicate and kind of keep up with each other. So I thought that was really helpful.
Thank you. Yes, you definitely had a different experience than Joyce. It was certainly easier. Rachel, how about you?
Hi everyone, good afternoon. Hopefully you can see me. I'm fighting with the sun a little bit, but determined to be out here enjoying the Colorado sun this afternoon. So I had never been to Michigan before until I drove up and moved in for the internship. But it was a really great experience. I was lucky to, kind of like has already been mentioned, have some people in my cohort that were just really welcoming, and I just put a message out there on the Facebook group saying like, hey, anybody have leads on a place to live? Anybody, you know, I would appreciate any connections in the Ann Arbor area. And so I think a couple people just kind of took me under their wing and introduced me to the meetup group, which I had never done any of those meetup groups before. This was back in 2012, so I was in the January 2013 class, so it's been a minute, but they introduced me to that meetup group, which kind of just opened my world to meeting all sorts of people in Michigan that I still am connected with now. So that was really key. And then in terms of living situation, I ended up just finding a place on Craigslist, and that worked out awesome. I had a car at the beginning of the internship, but then drove the car home for Thanksgiving and just flew back to Michigan and didn't have a car the second part there, and just rode my bike and public transportation, and like worked with Theresa to make sure my rotation was going to be on a bus route. And it all worked out just fine. But yeah, I would echo the being partnered with another intern for some rotations was really helpful in getting to know them and connect. But you definitely, I'm an introverted person for sure, so it was a leap of faith and going outside my comfort zone to meet other people, but certainly well worth it.
And Rachel, the year that you were here, were there other people that came from outside of just you?
Just me. Yep. And
Just you.
I don't know if I knew that ahead of time. So it was like, surprise, everybody knows each other, but you don't know anyone. So yeah.
I'm sure I told you, Rachel.
You probably did, Theresa.
Possibly.
Been a few years.
It has been. Nice to see you again.
Yeah, you too.
Because I think even Emily, there was a couple of you, right? Emily, it wasn't just you. I feel like you were a class that maybe had at least 2, if not 3 or 4.
I think when I applied, I think when I first came in, I was told there was 2, but then there ended up being like 3 or 4. Yeah, so
Yep.
I wasn't alone. But Rachel, just like you, I don't know what was going through my head, but I like was not. It didn't register with me that coming into it, everyone else would already know each other. So it's probably for the best, because then I didn't have that kind of thought going into it.
Yeah, less anxiety to be worried about up front. So the last 2 questions maybe we'll do together because they're kind of yin and yang. So just to talk through what was the best part of the internship for you, and then what do you think was the hardest part? And Joyce, I know you're kind of still in the middle of it, but if you can start us off by just sort of speaking so far.
Yeah. Yeah, since I'm not fully done with the internship, it's hard to say necessarily what has happened in the future, but I can talk about so far. I think one of my favorite parts about being in the DI program is that there are significant advantages of being remote at this specific internship too. And I can talk a little bit more about that with it's like, and I think it goes hand in hand, like being remote has been some of the nicer parts in terms of not needing to commute all the time and being able to like really manage my time well during this internship. And if you want, you can like potentially pick up like a little side gig if you have the time for it. So I think it's very flexible in that sense. But in some ways it's the hardest parts too, because of the fact that like you are remote and it's not the experience that you probably would want. And I don't know what your internship would be like in the future, but I do encourage, if you have the opportunity to do some remote programs, to try some, because I think there are really distinctive advantages to it in terms of like the number of projects you can do versus not being able to have the opportunity to network in a typical program. And then specifically to Michigan, I think also one of the best things about this program is, or like one of the strong reasons why I chose it, is that this is a program that is mainly like a short-term program. And what's also really interesting is that it also is just like only master students are in this program with you. So you'll have folks who have that additional like knowledge of what you've been through in the past. So I think that's a good camaraderie point that you'll see, and with the expectations of your preceptors too. I hope that answers some of the questions. I do want to quickly mention that I might not be able to join or I might not be able to answer questions after this session by face, but if you want to throw any questions in the chat box, I'll stay online on my phone, and that way I can like answer questions if you have anything specific to me and my journey too.
Thank you, Joyce. Much appreciated. Let's see, Emily, how about for you?
Sure. So the best part of the DI for me, I think, was some of the relationships that I was able to build during the course of the program, whether it be with my fellow interns or with my preceptors or people that my preceptors introduced me to. One of the main reasons that I chose the U of M MSDI, dietetic internship was because of the strong alumni base and connections that that the program has and that University of Michigan has in general. And that has definitely helped me even up until this day. So that's it's definitely something I encourage you guys to consider as you're going through this process. And then the hardest part, I would say the hardest part of what I think would have been hard from any DI program was that, not every rotation was applicable to what I wanted to do in the future or what I was interested in at the time. But I worked very hard to always find a silver lining to every situation that I was in. So for example, it was my favorite and sometimes most frustrating rotation was at the farm at St. Joe's. And it was super interesting and learning about farming and whatnot. But then, at the same time, I was like, well, I'm driving an hour out here to farm for a few hours, and it was hard to put it in perspective. And then I got poison ivy and I was like, oh, come on. But, at the end of it, I was able to look back and kind of see like all the amazing things that I actually did learn. And I had a really phenomenal preceptor and was able to also form a relationship with the clinical director at St. Joe's, who's also the dietitian for the Red Wings. And with my goal of working in athletics someday, that's an invaluable resource to me. And she was and still is to this day a friend. So, there's going to be hard times no matter what. It's a tough kind of period of your future career, but I think that at the end of it, you can always find a silver lining and something that you learn from it.
Absolutely agree. We tell everybody there's a growth experience in anything. You just sometimes have to look for it. And then Rachel, how about for you?
Sure. So I would say the best part was the variety of rotation experiences. So I was also at the farm, and that was definitely interesting and an experience. And then, it's like the next week you would maybe be in the actual hospital doing clinical or at the school district. So there was just a really good variety of different rotation experiences. And it was all, all of that was ready to go for me. It's not like a lot of the distance programs where you have to set up all of the rotations on your own. So that took out a good amount of stress for me. And then I would also say, I would say for the worst part, I don't really have a worst part of the internship. It was more just being really far away from my family and not having any money to go and visit them. So I didn't see them for like 6 months, that part was tough. But yeah, that was more just a personal thing.
Absolutely. Thank you. So I think what we'll do, and really thank you guys so much for being here and taking the time out to do this. I think we felt it was important since most of you, if you match or decide to come with us, will be coming from somewhere else, and just to hear from other people and what their experiences are, so that you have a sense of what that's like. So really thank you for doing this. If you guys have specific questions for Joyce, Emily, or Rachel, please, feel free, put them in the chat or unmute yourself. We'd love to hear your voice too. So, don't be shy if you want to do that.
Hi, I have a question for Emily. What sports nutrition opportunities did you have during the program?
So that was one of my first questions. I still remember my phone call with Theresa when I was applying and asking about the potential for sport nutrition opportunities. There is an elective option, or at least there was when I was there, and I'm sure that Caroline is still doing it. But that is with the performance nutrition division of the U of M athletic department. The director, her name is Caroline Mandel, and she is very well established in the sport nutrition world. She was one of the first collegiate sports dietitians in the country, and she's an incredible teacher. So that process, if it's still the same, I believe I had to kind of apply to it, or at least send some sort of resume that showed I had some kinesiology, exercise physiology background, or some sort of sport background. And then Caroline reviews those resumes and discusses with Theresa and Sarah about potential applicants that she's willing to take on. And I ended up doing a 3-week rotation with the U of M athletic department.
Yeah, I'll just add in there. We still have, Caroline is still a preceptor for us. We still have those rotation opportunities for sure. We also have opportunities with Eastern Michigan University and the sports dietitian there, who also runs her own private practice. And so that looks a little bit different than maybe it would at UM Athletics. And then thanks to Emily's connection to Michigan State, we're hoping to develop something with them as well. So I think that there are a lot of opportunities for at least university collegiate sports dietetics. Other questions for our panelists?
Yeah, I have a question for each of the panelists. At the end of your experience in the dietetics internships through all the rotations, how well prepared, or how much more did that add to your preparedness for the RD exam?
That's a great question. I think at least from talking to my the rest of my cohort about that too, those who finished on a clinical rotation, I think felt the most prepared because all of that material was like fresh in their minds. But even those like myself who finished on more of a community or food service based rotation, still felt very prepared. I mean, don't get me wrong, it's still, you have to readjust yourself back into study mode to study for the exam itself. But definitely, I definitely felt ready to go, within a couple of weeks after finishing my rotations.
Yeah, I would echo that. I think we got some of those like Gene Inman materials or whatever, the study guides, and those were really helpful. And I would just recommend getting your exam scheduled because it forces you to actually study and stop putting it off. I think because I finished in January, I took mine in March, which probably could have done it a little earlier. But yeah, I felt prepared after probably a week or two of like hardcore studying those Gene Inman materials.
Did that answer your question?
Yes, thank you very much.
And I'll just add to that quickly that we have people who take the exam 2 days after they finish, all the way to, many months out. Our recommendation is always to study as you go, learn as you go, and then take it as soon as you feel comfortable and not to put it off, for sure. Any other questions for the panelists? Okay, well, ladies, thank you so much for joining us. Feel free to stay. I don't know if you would want to at all, but you don't have to get off, or to hop off. And then we're just going to open the last few minutes, or however long people need, to ask any questions. I'm going to stop the share. Any questions you have for Theresa and I? And Theresa, is there anything that you can think of that we just like really forgot to cover? Oh, you're unmuted.
I know. I found it. I found the button. Not really. I think to stress to all of you, and again, this is, I think this is something, again, that differentiates our internship from others. And again, this is just knowledge gained from talking to other internship directors over the years, is our flexibility and our desire to work with each and every one of our interns to really fulfill your career destination. If you know, in other words, it's really important for Sarah and I to hear about what you aspire to and to try to facilitate that. Because we do have the, we have the opportunity to do that. We're not an internship that's going to keep you in lockstep. In other words, where everybody has to do the exact same thing. And I'm sure you can kind of hear that around, what some of our alumni have said and our current intern has said too. So for example, that farm rotation, I think it was first established a number of years ago because farm to table was actually, becoming a big deal. That farm that they're talking about is actually on a hospital campus, and it's all done with hoop houses because of Michigan's short growing season. So they actually raise, vegetables which are sold at the farmer's market inside that hospital. And so I've known the clinical director there for a number of years. She started that was her initiative. And, but not everybody, but you don't have to go and farm. Okay. I want to assure everybody of that. And I forgot that Emily got poison ivy, but anyway, but in other words, you can choose that, right? I guess that's what, I'd like to emphasize to each of you. But we've worked with people too that perhaps didn't know what they wanted to do, right? They came out of their graduate program maybe liking everything. I've worked with a gentleman a few years ago who unfortunately had a passion for nothing. I know. I mean, in general, he liked his public health program, but just didn't have a clue in terms of what he wanted to do. And that was okay too. So he didn't pick an elective. we just placed him in additional clinical outpatient areas. And then in truth, just listening to his situation after he graduated and finished the intern, my advice to him, and he allowed me, he asked me, so that's kind of nice too. What would I suggest? Because unfortunately, he didn't find his passion through the internship. There were certainly some rotations that he loved, but nothing that he really felt like he needed to do. But he had a lot of student debt. I was really pragmatic. I said, you know what? I think you need to get a job. I think you need a good paying job and get one fast. So it turns out that he ended up, he got employed within the first couple of weeks in a skilled nursing facility. He liked the population. And within 3 years, he is now the director of that facility, and he makes a really nice living, now, and he sits on our alumni panel, our advisory board. So you never know where your life's going to take you to either. But again, as Sarah said, we've worked with others with these unique elective rotations. She focused more on policy. We're open to everything. Those electives can be done outside of Ann Arbor. They can be done internationally. We have now just formally figured out how to do an international rotation. And, if that's your inkling, I'd urge you to think about that. We had someone that had a sister who lived in New York City and wanted to know how a food delivery, like a home delivery business worked. So those were the early days of like HelloFresh and Blue Apron. I mean, those were just starting to come on the market. And so she went and worked for 3 weeks and lived with her sister in New York and found out how the business side of that worked. Now, it turns out she's not really working in that, but she loved it. And I was willing to hear what was going on in that avenue. So, you're our opportunity too, to make sure that we're on the cutting edge of what's going on out in our field. So I guess I'll just do a little advertising of that. Okay, Sarah, feel free to give the formalized wrap up, I suppose, unless there's any other last minute questions.
I have a couple of questions.
Oh, yeah, absolutely.
I have two. One, I think it was Emily mentioned that her rotation was ended on clinical or the not on the farming, the community. So when you're set, are the schedules flexible? We set up our schedule with you so you can choose when you have certain rotations?
They are flexible in that we provide a list of the rotations that we have available every year, and we ask people to preference their top 2 community, their top 2 outpatient clinical, and then we ask if you know, where you would like to do your food service, in a hospital, residentially, or school. And then we work really hard to make that happen. And so outside of that, we have a lot of side conversations and behind the scenes emails where you may have a very specific interest that we're working to fit in. In terms of timing and when things happen, generally not. We're like putting a humongous patchwork quilt together. It's like 30 people on a spreadsheet, all in different locations at once. And so we don't have a ton of ability to allow you to make your own schedule in our area. But, you know, nothing's off the table. Never hurts to ask a question. You know, I think we're always happy to try to make things work where we can.
Okay, and another question. So you mentioned that there's likely to be more openings for outside students. What's changed at U of M that's allowing that? Is it more opportunities for internships, or just fewer students in the U of M program? What is that that's causing that openings for us outside students?
Fewer master's students in the program this cycle. Like the year before, or the year we were completely packed and we didn't take a single outside person. So it really is based on our student numbers, and sort of their what they want to do. If they are looking personally for a highly clinical internship, they don't choose to come to us, and so they choose to go into the match. So a lot of that's at play. But this year, I think it's mainly just being driven by our student numbers.
I have a question. Of people from outside the program who apply, how many have an MPH versus a Master's of Science in Nutrition?
That's a good question. It's pretty, we
Pretty
have both,
evenly,
yeah.
Yeah, it's pretty evenly split. I will say that if you end up with an MPH coming back, our program tends to make a little bit more sense. In other words, the majority of the cohort of our own graduates have an MPH. What we do also offer an MS degree, but those tend to be fewer of our grads that are coming in with an MS. So.
Thank you.
Mm-hmm.
I have another question.
Sure.
I don't know if you can answer this or not, but I'm not due to graduate until December of 21. So if I'm looking at an internship that starts in the summer, what do you recommend that a graduate do between the time of finishing school and starting an internship to help build their skills, I suppose, for an internship?
Mm-hmm.
Try to get as many experiences as you can. Whether those are, little volunteer experiences can go a long way to showing directors that you've tried to get as much knowledge and experience of what the field has to offer as you can. If you can do, research in the field or anything like that. So it's more those outside experiences, developing really good relationships with people who are going to be your references, because those recommendations go a long way. And if people can really speak to your strengths and know you really well, that's very helpful. Theresa, you've been at this much longer than me. So if you had anything more to add.
I'm assuming you're working right now too. So, yeah, I mean, I've had experience advising, students that are not even from the field, right? Of the field of nutrition and dietetics. It's really important to work, or as Sarah said, gain experience in the field of food and dietetics.
Right.
I find that the number of people and I guess it's just because of my own age. I'm older than I look. Anyway, that most of us come in with some type of food background. It would be natural, right? You'd think you're going into the field of dietetics, we should have some type of food background. But you might be surprised at the number of people that still don't have some type of food background. So I'm going to presume that you have some type of food background. And if you don't, you should go get a job in some type of food related job. So I think employment is really important. And then what you can't gain through employment, getting it through some other voluntary experience. And as Sarah said, a well-rounded background experience actually does it is looked upon very favorably. And so we're talking about all areas of dietetics, right? So community, of course. Clinical is often a very difficult area for applicants to gain any experience, but clinical can also be achieved through food service. In other words, I don't know of one health system whose food service department doesn't want to try and hire some temporary food service worker. And it doesn't have to be a hospital. It can be a skilled nursing facility. And in truth, I've had a couple of applicants in their student days, student days, where they went and worked for $10, $12 an hour on a temporary basis, delivering food to old people in a skilled facility, just for a few weeks or whatever. And through that experience, you're gonna learn your medical nutrition therapy inside and out, in terms of what does a dysphagia 1 through 7 stage diet really look like. So, I mean, it's small things like that. Research is great too. I'm not saying that it's not, but there are things. So definitely utilize the time. So it sounds like you're going to be an applicant in the future, right? Because your degree is not going to be awarded until December, it sounds like, of 2021.
Yes.
Yeah. Mm-hmm. So for our program, you must have your degree completed prior to the start of the internship. Yeah. Or shortly, very shortly thereafter. Yep.
Okay, last call for questions, and then I think we will wrap up. And for those of you enjoying or having a beautiful day, you can go out and enjoy it maybe. I'm going to pop my name and email in the chat, but also if you go to our website, you'll find how to connect with us. Oops, that was directly to another person. Hold on. Feel free to email. I'm happy to set up either one of us are happy to have a Zoom call or a regular phone call if you have more questions or if things come up later that you think of. If you're comparing two different programs and you want to know how we might be different, happy to talk through with you. We understand that this is a super big choice and super big time in your life. So we want to make that choice as easy for you as possible. Well, thank you, and have a wonderful rest of your afternoon. Bye now.
Thank you.